Hello, welcome. My name is Diamond. I'm gonna be taking care of you today. It looks like we're removing your Nexplanon birth control bar. Okay, perfect. If you don't mind, quickly before we get into the procedure, I have just a few questions to update your medical history. And then I just want to get your heart rate. We're going to check that, make sure it's not too high. And also a quick temperature on you. After we do that, we'll get into the procedure. It's actually relatively quick. Pretty much like that, it'll be done. Once we finish all of our questions, I'm going to clean off your arm. Do you have it in your right or left? This one over here. We're going to clean off your arm, and then we're going to inject just the smallest little speck of local anesthetic. And then that's going to numb the area just enough for us to make a little nick. Just a tiny little nick in the skin with a scalpel. It's very, very small. We are not going super deep all through the adipose tissue and all of that, so you will not need any stitches. It's pretty surface level right below the epidermis. We're going to slice it just a bit, and I'll be able to put a little pressure to work the bar out of your skin. We'll pull it out, clean you off, put a band-aid. Pretty much you're good to go. Okay, so let's get started. Can you confirm your last name and date of birth again? I figured. I know this is you, but I just have to ask. Alright. Any symptoms today of feeling sick at all? No? Alright. And have you traveled outside of the country in the last 2 weeks? Anything else that you want to discuss today? Any other concerns? No? Alright. I did want to ask you, since we are removing one form of birth control, do you have any questions about starting a different kind? Do you need any information? Or have any generalized questions about birth control? Okay. Oh, perfect. So you got a bunch of those little flyers? Okay. It's very important to remember, of course, there's a lot of different types. So you do have options. The options are not limited for most people. I'm just making a note that I asked you about this. Okay, let me get a temperature on you really quick. This is just a thermal. Okay. Alright, and this I just need to clip onto your finger. Hold on, because someone got a knot in the wire. Okay, and clip this on your finger. Perfect. And just let that sit. We're going to let it go for about 15-30 seconds. I'm going to check. Alright, let me see. Take your finger out. Perfect. Alright, let's take a look. Just slightly high. Do you feel a little bit nervous? Don't really like needles. I understand. No problem. Have you had any caffeine today? Okay, so that's probably also playing a contributing factor in the slightly elevated heart rate. Alright, I'm going to put my gloves on. And then we're going to begin, okay? Perfect. If you have any questions or think of anything during the procedure, please let me know. I'm here to help. just put your arm out for me? I'm gonna take a look, and just with this hand, I'm gonna grab and kind of pinch around and feel on your skin here, okay? Alright, let's see. Any pain? Perfect. Can you twist your arm a little bit more out towards me? Thank you. Yeah, alright. I do feel it. It's already good positioning where it's supposed to be. Doesn't feel crooked, doesn't feel like it's vertical, nothing. It's nice and horizontal. So what I'm gonna do is get this wipe. We're gonna make sure that your skin's nice and sterile right there. Alright, let me see your arm again. Perfect. Now just don't touch this area and leave your arm pretty much exactly where it's at, okay? Don't put it back down at your side. Just leave it. If it's uncomfortable, raise it above higher, but just don't come in contact with any other surface, okay? We want it nice and sterile. Now I'm going to get your Lidocaine. Sorry, my eye's itching a little. Okay, so we have that here. Don't look, I don't want you to get alarmed. I promise it's going to be a super, super delicate little pick. It is not going deep. It's not even going as deep as when you get like an injection. It is just very surface level, right under the skin. I promise. So, how are you feeling? Are you ready to go ahead and proceed? Yeah? Okay. So this part again is just going to be our little bit of lidocaine. Very simple. I just want you to focus on relaxing and taking some big deep breaths. Just relax yourself. It's not going to be bad at all, okay? Do you want me to count? Yeah? Okay. So here we go. I'm just going to get it ready. And I want you to take a big deep breath in on 3. 1, 2, 3. Perfect, that's it. Nope, I don't need to do any other spot, just right here. Okay, you're done. I think the cap fell, so we're gonna just be very cautious and put this over here for now. Okay, and I'm just going to rub on your arm a little bit in a circular motion to massage it. You doing okay? You don't feel faint or sick? Okay, good job. What'd you say? For what? Birth control? A shot, like a contraceptive, like a preventative? Yes, there is. So you do have an option for a shot. Did you not see the flyers out there? Okay. Just the oral contraceptive and the IUD and some other information. Okay, how about this? I'll make sure when you're leaving at the front, the assistant, Joni, I'll make sure she gets you one of those, okay? It has a lot of information. I want you to get the flyers so that you can have all of the information in front of you, versus if I just tell you, it might be a little bit harder to retain that for later. So don't worry, we'll make sure you get that, okay? Alright. Do you feel like you're ready to proceed with getting the Nexplanon out? Yes? Perfect. Okay. So what I'm going to do, I'm going to take this little scalpel here, and I'm going to put it right up to your skin. So just twist towards me a little bit. Perfect. And now what I'm going to do, I'm going to make this size of like a half a grain of rice. It's going to be very small. And I want you to just breathe in and out. You should not feel a thing. I'm going to get a little bit closer. You ready? Alright, here we go, little Nick. Alright, you okay? Perfect. Now what I'm going to do is just squeeze your arm a little bit here and manipulate that towards the top of the skin. You might just feel a little bit of pressure and pulling. No, you're not bleeding, don't worry. Just a normal amount. Okay, I do see the tip of it. Let me go ahead and grab these very small tweezers. This Nexplanon is usually like a hollow tube in the middle. And whenever you have that, it's easier to grab it with something super small. Just gonna put a little bit more pressure right here on the bottom. Should be able to slide that out. Alright, here we go. I think I've got a hold of it. Alright, there we go. This one's clear. Usually they're like white, green. I've seen red. Yours is clear. Very interesting. Let's put that down. Let me get some gauze to put on your arm. Let me see. Tiniest little bit, but it's not bad. This is going to be a non-stick gauze pad. We're just going to put that up to your arm right there. And you want to just hold that for me. 2 fingers, push on there. I want you to push on for the next couple minutes, so don't take it off. Just a good amount of pressure. Hold. Hold, please. Alright, that'll do. I'll get your band-aid ready. And that's it. The hard part's over. You did it. I told you you would do well. I knew you could do it. How do you feel? Still fine? Not faint or anything? Lovely. Let's get this ready for you. Okay. Alright, I want you to go ahead and remove that. Okay. Just push that on a little bit more. Alright, you okay? Yes? Good. We'll get this cleaned up. Now I want you to stop at the front. I'm gonna give me 1 second. Let me make a note. We have like a instant messaging system back and forth from back here up to the front. Super helpful for times like this. Okay, now she knows you need that flyer for the shot, for a birth control shot. Other than that, do you have any questions, comments, concerns? No? Alright. Well, you have a wonderful rest of your day. If there's anything that comes up that's bothering you, any new concerns, new health scares, always feel free to come in and talk to us. Alright? Alright, bye-bye. Take care.